Welcome back, everyone. We sometimes talk about mental health in blanket terms, but there's no such thing as one size fits all when it comes to mental health struggles. Now, July is National Minority Mental Health Awareness Month, and I recently spoke with Kaiser Permanente's Dr. Lateefah Watford about dismantling barriers facing underserved populations. Doctor, thank you so much for being with us. In terms of this discussion we're having now, do me a favor and please define minorities.
When we look at health in general, minorities are those of non-Caucasian descent. So it can be anything from African American to Korean American or Asian Pacific Islanders. Those would represent our minority populations. Minorities could also include people of different religious or faith beliefs as well.
Okay, and then we're talking about a term actually that I'd never heard of, syndemic, being associated with minority mental health. Tell me more about that.
So it is, at least to me, a relatively new term, but I actually do like it because what syndemic does is it takes into consideration all of the factors that actually can influence your health. So if you are a minority in America, for example, if you're an African American in America, it's likely that you have an increased level of stress. You may have some PTSD or lingering issues from racial microaggressions or aggressions. You may also have depression. You may also be socioeconomically disadvantaged.
Right.
So all of those things come together and then influence the outcome of your health and also, treatment outcomes.
Let's talk about the prevalence of mental disorders in minorities. How are you finding that it differs from other populations?
It varies greatly. I think that there's a couple different things that have to do with the prevalence when it comes to minorities. I think that it is likely underreported. A lot of minorities do not seek treatment for mental health issues. And we're seeing a big trend recently that is kind of swinging the other way. And we are seeing a lot more people seeking. Kaiser has done a magnificent job with the Find Your Words campaign and encouraging people to really consider mental health as part of their overall health. So we're seeing numbers, but across the board, when you look at it, the prevalence in minorities is a little bit less.
Well, it's good news that we are seeing minorities finally seeking the help, and with campaigns like Kaiser's, it's helping make strides in this. But what would you say are some longstanding stigmas or barriers that inhibit access to mental health care?
Just stigma against mental health and mental health treatment in general across the board has always been very prevalent. I think when you look at different populations, particularly those either of African American descent or maybe even those of other descents who perhaps are undocumented residents here, who are fearful of actually engaging in the system, so to speak, with the history of the Tuskegee experiment. There are a lot of things out there that make people resistant to engaging in general in health. But when it comes to mental health, you also have to understand that a lot of times there's not a real good understanding of what mental health is. And there's misperceptions about what it is and what it means, which then leads to people not either understanding that they need treatment or not seeking treatment.
Right. And what strategies are you seeing that are being employed to help improve the diagnosis of mental illness amongst minorities?
I think the biggest thing we can do is talk about it.
Right.
We need to have people understand that it's okay to talk about it. Because if you start talking about it, then people start wondering about it and they accept that, okay, this is a real disorder. I think the language we use is huge. We talk about, it sometimes a silent or unseeable disease, particularly like depression or anxiety. Whereas if I break my arm, I have a cast on, people feel sympathy for me. If I'm depressed, we go into the world and present ourselves in a way that doesn't necessarily show that disorder. So making people more comfortable with acknowledging that I have a problem and it's okay to seek treatment for said problem is really where we have to go with interventions.
Right. Doctor, such important information. I know we could talk about this for an hour, shoot, a whole day. So thank you so much. We appreciate your time. And it's so important that we encourage people to seek the help that they need, especially in these challenging times. Thank you so much.
Absolutely. Thank you.
Remember, if you or someone you know is suicidal or in emotional distress, call or text 988 or chat at 988lifeline.org. It is completely confidential. Trained crisis workers are available to talk 24 hours a day, 7 days.